Hello and welcome everyone to the NHS Project Futures Festival 22. It's fantastic to be back. If you're a regular attendee and at our events, welcome back. It's great to have you with us. And if you're new to the NHS Project Futures events, welcome and thank you for joining us. We hope you'll have a really enjoyable, insightful and motivational time with us with some of the leading experts and innovators in the field. We have a packed programme across 4 days, and we really want to ensure that you have fun, that you network and collaborate with other attendees. The hard work is done by you out there, and the more we can learn, share and support each other, the faster we will all progress. So this is a time out to invest in your development, your career and your professional progress. So please take a moment to say hi in the chat on the right-hand side of the screen and let people know what you do and which organisation you're from, because we really want you to make the most of this time and get to know your neighbours, your peers, and really make the most of connecting and collaborating and sharing. Also, whilst you're doing that, can you put in the chat what your hope is for the festival? What do you want to get out of it? Because that'll help us make sure that we meet your needs. So very quickly, I'm just going to show you what you can do on the platform today. So on the screen, you will see to the right-hand side of my presentation that there is a chat function. So in the chat, put your name, put where you're from and what you hope to get out of the festival. And next to that is the Q&A. We really want you to engage, connect, share your thoughts and ideas in the chat. But also, if you've got questions for the presenters, please get them in there and get them in early. Because the earlier you get them in, the more opportunities there is for other attendees to vote them up and for your question to be asked. We have a very short window with our key opening speaker this morning. So if you've got any questions for Dr. Navina Evans, who's coming to launch the festival, we hope you'll get them in quickly. So that we can ask her those key questions before she has to dash off to other really critical things that she has to be at today. So the other thing is feedback. We are really require the feedback from you guys at the end of each session. So please remember to click on the feedback link at the end of the session and let us know how it was for you. It's really important that we shape the events and the sessions to meet your needs and to get the most out of them. And your feedback is really invaluable. So please do remember to fill that in. You'll also be awarded points automatically if you complete the feedback surveys from the sessions, which all go to your overall gain points, which I'll talk about a little bit later. And some of the other great features that we have running during this festival once we've heard from our opening speaker today. So coming back then to the opening of this session, we're very lucky to have Dr. Navina Evans with us today. She opened the festival for us last year. She's very kindly come in from a very busy morning schedule. Navina is the Chief Executive of Health Education England, and she is here to bring her insights from her current role as Chief Exec, but also from her clinical background in children and adolescent mental health. And that perspective, bringing that to the challenges and the opportunities that the healthcare system is facing at this time, is something that will be really useful for us to understand. And also what we can do as the Project and Change workforce to help the sector to thrive. So, do we have Navina with us? I think we're just getting it back on screen. Welcome, Navina. And thank you so much for joining us today. We really appreciate you giving us this time and appreciate how busy you are.
Thank you so much, Jo. Thank you for the introduction and thank you for the invitation to be part of this event in this small way. I'm really delighted to have this very special privilege to open the Project Futures Festival 2022. I feel a little bit embarrassed to be in front of all these kind of experts and enthusiasts today. because I know so very little. But one of the things I can share with you is your enthusiasm. So thank you for the warm welcome. I have to say this morning, what a strange time we live in right now. Everything else that's been going on around us and in the wider world, I think it's quite important to acknowledge that we're all feeling a little bit anxious, we're all feeling a bit sad, we have very mixed feelings, but also that this is a really important time to come together in many, many different ways. And I think this festival is one of the ways in which we need to come together. I recall last year's festival, actually, and it really doesn't seem so long ago when people were together. It was a really exciting time, and I watched very closely the outputs, especially on Twitter. So I will be doing the same again this year. So I look forward to lots and lots of information and interaction via social media. Now we're actually entering into a time which is a new way of being, a new way of living in our society, a new way of being at home, but definitely a new way of being at work in both health and care. So it's time now that we double down on our efforts to spread good work, to spread innovation, to think about how we want to be part of a health and care system for the future. And now more than ever, it is so important to be able to spread hope. So this year, I just wanted to say a few words about the fact that all of you at the festival will be celebrating 12 months progress in the development of the healthcare project and change community, and also in the continued capability development, education and training, and also the resources to help the system deliver effective service improvement and change. I mean, you guys have been really busy. So we're in the phase now, it's really timely when we start to think about the next steps in the NHS, but also the next steps in health and care as a wider system, supporting recovery, supporting system integration. This is a really exciting time to be part of all of that. So the rollout of the project and the change workforce can provide to support healthcare with new ways of working. So that's a really, I'd quite like to hear a little bit more at the end of this, your thoughts about new ways of working, about how we can really embrace social and technology advancements in delivering cutting edge services. We learned a lot in the last 2 years. We really pushed the boat out. We learned what went really well. We also learned from some of the mistakes and some of the things that didn't work really well. So I really hope that we will build on all of that learning for the future. There is no question of going back to the way things were in the past. So the importance in all of this, as we enter into this kind of new phase of how we do things in the future, I want to stress the importance of who we are as people. So we understand about projects and we understand the theory, you have all the knowledge, you have all the tech and all the stuff that can make all this happen. But it's so important that we don't forget that all of this will only be a success because it depends on us as people and individual, our values, our behaviors. And I think at the center of all of that is compassion, collaboration, and inclusion in the design and delivery of future healthcare systems, which will properly meet the different varying needs of the people who we represent, the people who we serve. And it's really important that if we focus on the people with our values and behaviors, we will then be able to retain talent and experience to help this work to thrive. So my ask for you, my plea to all of you today is to really think about how you can influence and grow this community, grow this movement, that it's all about improvement and looking to a future full of hope and better times. Thank you, Jo. I hope we have time for some questions. I wanted to say that.
First one of the
My
day.
first one of the day.
Oh, that's great. Thank you, Navina. That's really great to get those insights. We do have a couple of questions. It'd be really great to get your thoughts on this. So first question we've got is, what's the most important thing we can do to build the right cultures and behaviors for the future?
So I think, look, there are some really simple things, like as I mentioned earlier, those words, compassion, inclusion, I think collaboration, and that's what this whole thing is about, isn't it? I mean, the words I'm seeing on the screen: collaborate, innovate, shape the future, and you can only do that by bringing the best of ourselves and our values. I think that the only other thing I'd say is most of us are in this business because we share some values and beliefs around health and care. So that's a great start. So I would encourage us all to be really open about thinking always as a thread. How are our behaviors going to impact this? How are we going to tackle behaviors in order to make the change for the better? Great question, Jo.
Okay, that's great. Thank you. We have another question, which is, can you tell us what the plan is for the new merged organization?
Yes, so this is very exciting. So there will be a new NHS England in the future, which is going to bring together Health Education England, NHS Digital, NHS X, and the two bits of E&I all into one organization. And this is a big, huge task, but I think it's timely. And for us at HEE, what it will do is make sure that training, education, and workforce planning is at the heart of everything that the NHS does. I think we've done well over the last 10 years, or 9 years, I think it is, as HEE. But I think it's time to take it to the next level. So that's the main thing for me, that actually this will be a thread. Training, education, workforce development, workforce planning will be a very prominent thread in how we deliver services.
Okay, that's fantastic. Thank you. And in terms of system priorities, what are the big ticket items that we should be focusing our attention on in order to get the system up and running again?
Yeah. So, Jo, you mean system, and you say system, you mean the health and care system, right?
Yeah.
Yeah, sure. So I think that the most important thing that I've learned is to try and stay really aligned and close to the point of care. So everything we do needs to be relevant to what's happening on the ground. Okay, so it's no point us all going off and thinking about some really amazing stuff if it doesn't translate into outcomes for the people we serve. So being really aligned to the recovery plans is really important. But the other task for us is recovery is maybe the next 3 years, but we also need to think about the next 5 years and the next 10 years and the next 15 years. And a lot of innovation, that's the bit about shaping the future. So the question I would ask you to think about is, how does what we do now, how do we articulate that what we do now will be really relevant for shaping the future? And that's the long-term future.
Okay, fantastic. That's really great. We have another question come in, which is, how can we influence up and get some senior leaders to really change and shift from fixed to growth mindset?
Yeah, well, this is always a tricky question that comes up quite a lot. So I think, okay, I'm going to give you 3 kind of top tips, I guess. One is find the people who are like-minded. So it's about creating a movement, isn't it? So you find the people who are like-minded, get them to become your sponsors, and, you know, get in there, be like water, get into all the cracks. So that's the first thing I'd say. The second thing is, bring this alive, you know, bring your ideas and innovation really alive so that you're saying to people, this will help you solve that particular problem you have right now. And that's when I think, as a leader, I become interested, when I think, oh my goodness, this is really going to help me to solve that particular problem. The third thing is, money is we're really strapped for funding. So again, if it is something that is from within existing resources, how we can repurpose and reshape what we do, for a leader, that's really attractive. Thanks, Jo.
Okay, fantastic. That's a really great answer to that question, and some really useful kind of insights. I love the be like water, and sort of soak into all the nooks and crannies. That's really fantastic. That's the last of the questions we have, and appreciate that we've had some time from you this morning to get those insights. Thank you so much for being with us this morning. Was there anything any last words you wanted to say in terms of opening the session?
Well, thank you so much, Jo. What I'd like to say is I want to just thank everybody for everything that you've done over the last year since the last festival, because, you know, we've had loads of challenges thrown at us by the pandemic, and it's really important to keep this work alive, which you have done. And I look forward to hearing about the outcomes from the festival and how we're going to take them into practice, into the point of care. Thank you. Have a good time.
Thank you so much. That's fantastic. Thank you, Navina. And we will make sure that we get the real value from today's and the whole week session, and we'll share those back. Thank you very much. Well, that was great. And what a great way to start what is going to be an amazing day. We have a fantastic lineup of people to share with you across the whole week. And the first ones today, we will take you through. I wanted to mention that we want attendees to really make the most of this, to collaborate, to innovate, to shape the future, to take what Navina said and really create some solid, tangible differences for the people that we represent. Now, I know we have some people with us today that aren't part of healthcare. We opened the festival up and made it available to those across the public sector. So if you're here from another government department or another organisation, welcome. It's fantastic to have you with us. There isn't much that we think that won't be of use to you, because I think a lot of the things that you'll be able to hear and learn from people at the festival this week will be applicable whichever environmental sector that you're working in. So please do get involved, get connected, contact your peers and counterparts, because there's some really great learning to be had from sharing experience across different sectors and different environments. And it's really healthy for the NHS to look beyond its borders as well, and to see what else is going on out there and what we can learn from you. So please do get involved. Don't be shy. Say who you are, where you're from, and help to connect and share with us across the whole 4 days. So if we can go back to looking at the screen, what I'm going to do now is to give you a quick tour of the platform, do a little bit of housekeeping so that you can get the most out of the time that you are with us. We appreciate it's very hard to be able to plan in a whole 4 days. So you may be ducking in and out of sessions throughout the week, and we want to make sure that you get the most from it. So if we can have a look then at the platform, we've shown you what you'll get from the individual session and how to interact with the individual speakers. Please do chat among yourselves, talk about what your thoughts and reactions are, add your questions and make sure that you get those across. We do monitor those, we feed those back to the speakers, and we take note of the key themes and ideas and things that come through, and they help us take things forward. But you also notice then on each of the sessions that you might find that there's documents attached, there's links to other resources. So if you find a speaker really helpful and engaging, there's lots of other information that you can access as well. So in terms of the agenda is there, and please do share it with your colleagues if you think they might not be aware of it. We also have a banner attached so that with the link so they can register for the festival. We have an amazing selection of speakers from across all sorts of different subject areas. So we've got change management, we've got program project management, we've got PMO, we have insights into innovation, data analytics, neuroscience. We have key speakers who are going to talk about what's going on. So Fiona Spencer to talk about the direction of travel for government, Adam Bodison from the Association for Project Management talking about what's happening with the profession as a whole and what we can expect from them in the future. We also have some insight sessions. to find out a little bit more. And we have a key one this morning from the APM who's going to talk a bit more about the opportunities to develop your professional credibility and accreditation. We also have, based on feedback from previous events, we've scheduled in networking and time for the festival quiz. We had a full schedule last time, and there wasn't really enough time for people to get to know each other, to look in the networking sessions and really to share and connect with their counterparts and with people in the other regions and other organizations. So across the week, make sure that you are aware of what's in the schedule and what you can get from it. There's some really fantastic sessions. As I said, make the use of those networking sessions. If you go into networking, you'll then see who's on the system and who's available. We've got Katie with us today, and show she's online because there's a little green box there. And Katie has made video calling and chat available, and it'll also tell you where she's based. And Katie's lovely, so feel free to get in touch with Katie and share what you're doing. You can search for people by name, by organisation, or by region. So we know that we have quite a few folks from Scotland with us. So if you search for Scotland, you'll be able to see who else is there from your region. If you're from the Midlands, put that in. If you're from London, South East, South West, find out who else is in your region and connect with them and get to know them. So thank you for joining us. We're also wanting to develop our branches and networks in Northern Ireland and Wales. So if you are here from either of those countries, do let us know, because we'd love to get you connected up with your counterparts or connected up with whatever network you might have in place already. We have some regional network leads and champions and ambassadors that you can connect with and join the local regional network. So please do connect and join them. We also have, and this is where the game codes comes in. So it came up at the start, and one of the key things that we have for the session is a game, because we want this to be a bit more fun than the usual kind of conferences. And so we've set a challenge. We have a quiz that goes on all week. There'll be new questions coming up every day. It's there to challenge, to inform, to educate, but also to stimulate and just a bit of fun as well. But there are prizes. So the more points you get, the better chance you have of winning a prize. And each session comes with a code. Now, at the start of this session, you may have missed it. So this is why I'm showing it to you again, but this is the only time you'll get that code shown again. So if you see the code that says you're rewarded for promptly turning up to the session on time, the code is workforce, and for putting in that code, you win 50 points. There's also a code at the end of the session, so keep an eye out for that one as well, because that will only come up the once if you stay to the end. And then if you go into the game session, Festival 22 game, you can enter a code, put in the code that you found, workforce, and submit it, and you will be given 50 points. So, as I said, points make prizes, and there is a leaderboard that we'll be looking at every day. So David Duran, well done you. He's got in there quickly and he's scoring all the points. So for the competitive ones among you out there, if you go into the incomplete section, it will show you all the questions that you can answer, as well as the ones that you can gain from attending the start and end of the festival on time. And there's other points to be made as well if you contribute to the activity feed. So if you post something interesting or ideas or images, and also we're really keen for you to join and share your experience on social media. So we have a Twitter feed, and the hashtag is NHS Project Fest 22. And we have a number of prizes for the best social media, because this is about us and entertaining us. So you get a prize for the funniest tweet, for the most motivational, or something really insightful. And there's some really good prizes. So it's really good to be able to share some of those and help keep everybody entertained and engaged. And Pam's the one to beat. So she is great at coming up with really funny and engaging tweets. So if you follow that hashtag And also follow the community, and it's at Healthcare PDC if you want to keep in touch with what's going on social media, and also join our LinkedIn group as well. You also get points if you come and visit the exhibitors. Now, we have a bunch of exhibitors in the exhibition hall, and these are all really interesting companies that are professional bodies, that they're education and training providers. And there's some really good resources, documents, guidance, contact details. And if you come and visit them and come and access some of those resources, you also get points for visiting all the exhibitors. So coming back to the surveys, you will see that there was a survey for each of the sessions within the session itself. But if you missed that and want to go into it and say, fill that session in, we will, you'll also get points at that stage. So we know that you're a competitive bunch, and at the end of the week, we will have an awards ceremony. So there's some great prizes that have been provided by some of our speakers this week, and they're really going to be a great addition to your learning and development. So do get involved in the quiz, have some fun, post on social media, and make sure you make the most of it. Of course, the other thing is all of the sessions will be recorded, and they will then appear in that session slot for you to view on demand afterwards. So do come back and watch them, because there are some really great speakers. It'll stay on the platform, and you can access the platform until, for effectively the rest of the year. So all the events we've had previously, if you've not visited us before, you can go back and you can look at those sessions and watch them on demand, and also access the resources that were available for those sessions. So this was the Change Management Institute and things relating to them. So do have a good look around and make the most of your time out from the day-to-day grind to develop your learning and development, and also to look at how you can really help to shape your learning, your skills, your team for the future. So without further ado, we have a 15-minute break before we go to what will be our key speaker for this morning. So if you're not familiar with Stephen Carver, he is a wonderful speaker and orator, and he will be joining us to give us some really fantastic insights into the current space race. So go grab a drink, start the game, and we'll see you back here in 15 minutes. Thank you very much.